You know, it's hard to think of any medications that have captured the world's attention quite like these new weight loss drugs. They're everywhere, on magazine covers, dominating the news, all over our social media feeds. But if you look past all the headlines and the hype, what does the science actually tell us? Let's take a calm, clear look at the evidence together.
So, the big question is pretty simple, right? Do these drugs really deliver on their promise? Well, to answer that, we have to look at two different things: the incredible potential we see in perfect, pristine clinical trials, and then the reality of how they work in everyday life. And it all really started with one very specific number.
20.9%. This is the number that really set everything in motion. It was the average body weight loss that people achieved in a huge clinical trial for one of these new drugs. Now, a result like that was just unheard of, unless you were talking about bariatric surgery. And it's exactly why these medications became a global phenomenon. To understand where it came from, we have to start in that highly controlled environment of the clinical trial.
So let's begin by looking at the best-case scenarios. We're talking about the results from these super-controlled, scientifically rigorous studies. This is where we get to see the absolute peak potential of these medications when they're used under ideal conditions. First up, we've got semaglutide, which you probably know by its brand name, Wegovy. Its effectiveness was really proven in a series of huge clinical trials, known as the STEP program. And these studies were looking specifically at its effects on people with obesity but who did not have type 2 diabetes. And the results? They were pretty remarkable.
I mean, the difference in the outcomes was just massive. After about 68 weeks, the group that was taking semaglutide lost, on average, almost 15% of their body weight. Now compare that to the placebo group. They only lost about 2.5%. This was a really groundbreaking result, and it showed a clear, powerful effect coming directly from the medication.
But what does an average like that really mean for individual people? Well, when you break it down, the numbers are even more powerful. A huge 86% of the participants lost at least 5% of their body weight, and that's the amount that's considered clinically significant for health benefits. Almost 70% lost 10% or more, and a full half of them lost 15% or more. That shows you just how consistent the results were.
Okay, so next up is Tirzepatide, which is marketed as Zepbound. Now this one is a bit newer, and it works on two different hormone receptors, GLP-1 and GIP. The theory was that this dual approach would make it even more powerful, and, well, the clinical trials were designed to see if that was true.
And the results? They were pretty definitive. In the big SURMOUNT-1 trial, which ran for 72 weeks, people on the highest dose of tirzepatide lost that headline-making average of 20.9% of their body weight. This just set a totally new standard for what was possible with medication, really blowing past even the amazing results we saw with semaglutide.
When you look at the individual milestones for tirzepatide, the numbers just get more and more striking. Over 80% of people lost at least 10% of their body weight. And most remarkably, more than half of them, 56%, lost over 20%. And get this, over a third of them even crossed the 25% mark, which puts their results right in the same ballpark as bariatric surgery. So, yeah, those clinical trial results are amazing. No doubt about it. But they happen in a perfect little bubble, right? The next logical question is, what happens when these drugs leave the lab and enter the real world, with all its messiness and complexity?
And this is where we get our first big reality check. So while tirzepatide hit that peak average loss of nearly 21% in its trial, a big study that looked at data from doctors' offices found a more modest average loss of 5.3% over 6 months. Now, that is still a significant amount of weight loss for sure, but it makes you wonder, why the big difference?
Well, it turns out there are a few really important reasons for this gap. A huge one is just adherence. In the real world, people miss doses or they run into supply shortages. One study actually found that over half of patients had gaps in their therapy. Also, having type 2 diabetes can make the drug less effective. And on top of all that, there's just huge biological variability from person to person, and most of this real-world data is collected over shorter time frames than those long clinical trials.
This brings us to a really critical part of the story, and it's one that often gets lost in all the initial excitement. These drugs are incredibly effective while you're taking them. But the big question is, what happens when you stop?
To really get this, we have to talk a little bit about biology. Our bodies have this powerful built-in drive to maintain a certain weight, which is often called a set point. So, when we lose a lot of weight, our biology actually fights back, trying to get us back to that previous higher weight. This is something called weight suppression resistance.
And the data from the SURMOUNT-4 trial gives us a really clear picture of this.
So after people had lost almost 21% of their weight on tirzepatide, some of them were switched to a placebo. That group regained an average of 14% of their body weight back within just 1 year. Basically, they regained about 2/3 of all the weight they had lost.
And look, this isn't about someone losing their willpower. Not at all. It's a completely predictable biological response. Once the drug is stopped, that powerful appetite suppression just vanishes, and the hunger signals come roaring back. At the exact same time, the body's metabolism slows down to save energy, and things like psychological habits and even the bacteria in your gut can go back to the way they were before. It all works together to bring the weight back.
So this reality of weight regain really forces us to reframe how we think about these medications and also how we think about the condition they treat. It suggests that we need to stop thinking about obesity as a problem you can just fix and start seeing it as a chronic condition that needs to be managed over the long haul.
You know, a helpful way to think about this is to compare it to something like bariatric surgery. While these GLP-1 drugs can produce weight loss that gets close to surgical levels, the key difference is durability. Bariatric surgery physically changes the body, which leads to much more sustained results over time. In contrast, the effects of these drugs are really powerful, but they're also temporary. The durability is low once you stop the treatment.
And that brings us to this key idea: chronic maintenance therapy. It sounds complicated, but it's not. It just means treating a condition on a long-term, continuous basis. It's the same way someone with high blood pressure takes their medication every day to keep it under control. These drugs are a management tool, not a short-term cure.
So, after looking at all the evidence, from the incredible promise of clinical trials to the complexities of the real world, what's the final analysis? Well, it's clear we've entered a brand new era in how we treat obesity, but it's an era that comes with some really important nuances.
Let's just quickly recap the key takeaways. First, in those ideal trial conditions, these drugs deliver truly unprecedented weight loss. Second, in the real world, the results are still meaningful, but they're definitely more modest. And third, and this is crucial, stopping the medication leads to regaining most of the weight that was lost. It all points to the same conclusion. These drugs are best understood as a long-term, chronic management tool for the disease of obesity.
And that leaves us with one final big question to think about. The science is showing us that obesity is a complex, chronic condition with powerful biological drivers. So, as our tools to manage it become more effective than ever before, maybe the biggest shift won't just be in our medicine cabinets, but in our perception, moving away from a perspective of personal failure and toward one of understanding and long-term management.